In this and future global health reports, we will follow a similar agenda. We will discuss the global situation, especially focusing on lessons learned and misconceptions that previously hampered our ability to successfully mitigate this pandemic. We will be developing an international watch list in the next global health report. Because this is the Olympic countdown, we will be following the Japan situation, focusing with intensity on the Olympics. We will also emphasize disease transmission pathways, focusing on the most current understanding of the characteristics and disease ecology and epidemiology of the novel coronavirus, while focusing on strategic infection prevention methods as the Delta variants change our perception of containment and mitigation. We will be discussing the ramifications to social distancing, personal protective equipment use and behavior, and potential transmission pathways that can no longer be disregarded. Global situation. United States. Vaccine hesitancy. According to the NBC News, in an article entitled "More than 150 Fired, Resigned Over COVID Vaccine Requirements at Houston Hospital," a judge earlier this month dismissed an employee lawsuit over Houston Methodist Hospital System's vaccine requirement. More than 150 employees at the Houston Hospital System who refused to get the COVID-19 vaccine have been fired or resigned after a judge dismissed an employee lawsuit over the vaccine requirement. A spokesperson for Houston Methodist Hospital said 153 employees either resigned in a 2-week suspension period or were terminated on Tuesday. The case over how far healthcare institutions can go to protect patients and others against the coronavirus has been closely watched. It's believed to be the first of its kind in the U.S., but it won't be an end of this debate, according to the report. New Brunswick, Canada. Outbreak of suspicious transmission mode. An article produced by the Canadian Broadcasting Corporation entitled Delta Fredericton Outbreak, fueled by B1617 variant, may be spreading by surface contact, states a strong probability transmission is via fomites, such as doorknobs and phones, says internal memo. It continues. A growing cluster of COVID-19 cases at the Delta Fredericton is fueled by the variant first reported in India, and health officials believe there's a very strong probability it's spreading through surface contacts rather than respiratory droplets or aerosols, according to an internal Horizon Health Network memo. Horizon's COVID-19 Committee on Infectious Disease and Infection Prevention and Control, which is co-chaired by Dr. Gordon Dow, a member of the Provincial Pandemic Task Force, described it as an outbreak in a bulletin to staff Monday, end quote. We will be keeping an eye on this particular outbreak and update you in the future. Sydney, Australia. Fleeting exposure. Due to exposures linked to a single COVID-19 infected person, more than 1 million people in Sydney are now in lockdown as the city struggles to contain COVID-19. According to ABC News, the report continues, more than 1 million people living in Sydney have woken up in a lockdown as the city battles to bring the latest COVID-19 outbreak under control. According to the report, the Bondi cluster, which began after an unvaccinated limousine driver transported international flight crews, now stands at 80 cases. Various news reports portray alarmingly short-duration exposure pathways, including the transmission of disease from one person to another casually brushing near the other, as recorded in surveillance video. Canadian officials have discussed in press conferences their concern that the level of infectivity has surpassed previous descriptions. Outbreaks occurring at beauty salons, dry cleaners, and other businesses have been well documented. A new term, fleeting exposure, is being utilized that perhaps may be added to the public health and epidemiological lexicon in the future. In the last 6 months, both WHO and CDC have been adding to precautionary language that COVID-19 can be transmitted across distances greater than 6 feet as previously described, protective in social distancing recommendations. Australia provides the public with enviable transparency of reporting. According to 9 News Sydney on June 27, 2021, among the many businesses specifically listed by name as being implicated as points of potential infection sources, with requirements for people visiting those locations to submit to COVID-19 testing, a particular seafood manufacturer was emphasized. If people received shipments from that supplier, they are required to be tested. According to the televised news report, it is estimated that the lockdown and investigative processes, including contact tracing follow-up, amounts to Australian $2 billion loss at this time. According to the June 26 Asahi Shimbun, the latest tally of infections in the capital stood at 534, 146 more than the previous Saturday. The daily average of new cases for the week ending June 26 was 476, representing a 26% increase over the previous week and indicates a growing, worrying trend in the capital, according to the article. In March 2020, we worked with the editor of the Journal of Environmental Health, a premier product of the National Environmental Health Association, to provide a disease transmission pathway guidance document for in-practice public health professionals in lieu of perfect information. Notice that Figure 1 cleanly defines 3 separate infection pathway groups: person-to-person, environmental, and zoonotic. This pandemic, like the 2003 SARS global epidemic, began in animals. It is a zoonotic event. You may find my article on topic interesting, published on Medium. What was the origin of SARS in 2003? Of course, we will describe the Wuhan, China zoonotic pandemic source at a future point in our Global Health Report. We now expand upon our Figure 1 from our paper entitled An All Hazards Approach to Pandemic COVID-19, Clarifying Pathways of Transmission Toward the Public Health Response. In March 2020, it was virtually uncharacterized, and we utilized comparators such as SARS, MERS, Ebola, and other common infectious disease such as influenza and even the norovirus. Although CDC was then not recommending face masks for all people, we were concerned from an all hazards perspective, accepting that the threat to the pathogen was elevated due to uncertainty, that airborne aerosol transmission was likely, and that eyes should also be protected. Droplet, aerosol, fecal-oral, and sexual transmission pathways are specifically delineated under the person-to-person pathway. Under an all-hazards readiness rubric, we intended to move forward in the crisis without proven data. For now, it is the Delta variant that is the game changer. Following various resources, it appears that the Delta variant, which may be hundreds of times more infectious than earlier COVID-19 strains, may be proven to be more easily transmissible by pathways not commonly considered high priorities, considered lower probability infection sources, such as contaminated environmental surfaces, also referred to as fomites in public health circles. We will be updating this disease transmission pathway figure, sharing other aspects with the most current information in current and future global health reports. For the next 29 consecutive days, we will follow the Tokyo Summer Olympics Games from a global health perspective. Today we discuss what it means to hold the greatest international sports event during a pandemic, the risks, the surprises that we will encounter, and the questions that you will have. Each workday, we will provide to you the most current situation in Japan and in the world. We hope that you will subscribe to this unique channel, trusting that you will find it useful. I am pleased to present to you our Global Health Reports. We welcome you to our very first issue of Olympics Countdown, published daily. In this channel, Global Health Reports, we come to you as health scientists and public health experts who were engaged at a federal emergency agency throughout 2020 in the U.S. response to COVID-19. As researchers continuously involved in studying pandemic COVID-19 from its earliest stages in late 2019, we reviewed over 15,000 COVID-19 articles and news in multiple languages and published scientific papers on subject. We also both teach global health and are frequently invited to speak and work as subject matter experts. Our intention is to follow the progression of the pandemic throughout the Tokyo Olympics, chronologizing significant information and new updates while we apply our knowledge of the novel coronavirus and its rapid evolution towards becoming a more infectious and deadly disease. We will be providing information specifically for the Japanese, apart from the information that we are providing to the rest of the world. We will be discussing disease transmission pathways, prevention strategies, including social distancing and other engineering controls that we will have great impact on all people. It is our intention to share our information to help inform you.